Hello everyone, welcome back to Nursing with Bonomi. It's Nurse Nay. Today we are going to talk about calling the doctor for abnormal labs. This video is a video request from Nessa Colon. Thank you so much for requesting this video. Alright, so the doctor has ordered a CMP, a comprehensive metabolic profile. What does that test measure? It measures quite a few things, some of which are glucose, BUN, creatinine, sodium, potassium, calcium, albumin, as well as some other things. So when I called the doctor to report lab results, I would say, I have labs for so-and-so available. Would you like me to read off all of the results or just the abnormal ones? And usually they would just want the abnormal. Sometimes they would want everything. This is if you're not able to fax them the results or if they're not able to look them up in the EMR. So I would say, for instance, the potassium is 3.2, which is low. The reference range for potassium is 3.5 to 5.2. I wouldn't tell them that part. I would just give them the result. And let's say the calcium was a little low too, at like 8.4, which isn't that low. The reference value for that is 8.7 to 10.2. So if the potassium level is low, usually they're going to want to order some potassium. So they might say start them on 20 milliequivalents of potassium once a day. Recheck the CMP in a week, just as an example. Usually if there's an abnormal lab result and they give a new medication, they're going to want to reevaluate to make sure that the medication is effective and doing its job. Let's do a combination of a CBC and a UA or urinalysis. So maybe the white blood cells are elevated at about 13. The normal reference range for that is 4 to 11. So that can indicate an infection if the white blood cells are elevated. Say they also had a UA obtained and you got those results as well. You are going to report any abnormalities to the doctor. If it was normal, you would want to let them know as well. You always want to let them know, hey, I have lab results, everything was normal, or hey, I have lab results, this and this were abnormal. So let's say they also had some white blood cells in their urine and they had some bacteria there and a little bit of red blood cells. All of that can indicate an infection, especially bacteria. So if there is a large amount of bacteria, the doctor is going to want to know what antibiotics that bacteria is sensitive to, which means what antibiotics are going to kill that bacteria. So sometimes, well, most times you have to wait for a culture and sensitivity to come back because it takes longer to grow. So you'll get the results that hey, there's E. coli in the urine, but then it'll take a couple more days to get the sensitivity to what antibiotic is going to kill that E. coli. Now, a lot of times the doctor will start them on what's called empiric treatment, which is when they choose an antibiotic that's usually going to kill that bacteria, which in this case probably be Bactrim. That's a common medication used to treat urinary tract infections, depending on the bacteria. So when you do report labs to the doctor, you also want to have any pertinent medications that the patient is taking already available. So let's go back to the CMP result where the potassium was low. You would want to let them know, hey, they're already taking 20 milliequivalents of potassium daily. So that's important because their potassium's low, which means that that potassium dosage isn't working for them. So maybe they'll say, okay, bump it to twice a day or bump it to 40 milliequivalents daily, and then recheck in 3 days. So that is an example. Also, when you're reporting an abnormal UA, it's important to note that if they are on warfarin or amiodarone and also have any allergies available. Warfarin and amiodarone can interact with antibiotics. When it comes to warfarin, it can affect the INR, so the dosage of the Coumadin may need to be altered, or it may need to be more closely monitored to make sure that it's within the range that you need it. If a patient has a low hemoglobin and hematocrit, it's important for the doctor to know if they're on any blood thinners and if they're taking any iron. If their iron is low as well, the doctor may want to prescribe iron for the patient. Anytime that the values are off and there's an intervention put in place as a new medication or removing a medication, it's general practice to recheck the labs a few days later to make sure that they are improving. And usually I would wait till, if say you're on night shift, wait until like 6:30, 7 in the morning to report a lab value unless it's critical, or hopefully if you get the results earlier in the shift, do it as soon as possible. That way an intervention can be put in place. But there's no need, unless there's a critical lab result, to call them at like 2 in the morning to let them know that their potassium was just a tiny bit low, or that they have some bacteria in their urine. I wouldn't do that at 2 in the morning because it's not critical. Now, if their hemoglobin or hematocrit was like super low, then yeah, you would want to call them because it may require more rapid treatment. Or if their potassium is critically low, like 2.5 or something, that's important because that can cause all sorts of problems with your heart. So yeah, I hope that helps. Please make sure to put your requests down in the comments as well. And any questions that you have, make sure to also go check out my progress note ebook that has samples of what kind of progress note you would write if the doctor started a new antibiotic, or you got a new order for medication, or you got lab results back. So make sure to check that out. And thank you for watching. I hope you guys have a great day.